Okay. All right, and then the next item, approval of meeting minutes. I believe that those were emailed. And if you were able to review that, would you go ahead and go ahead and give a motion to accept the meeting minutes as prepared? Okay, let me take this phone call quick. Okay, well, we'll go ahead and just move on with our agenda. And provide a situational report. I don't see Tyree on. Hold on a second.
Tyree is not in. She is at the Comey and A1C screening event out in Loop today.
Okay, so we won't have a situational report as far as the positivity rate at this time. We'll go ahead and email that report out. As far as COVID amongst the school age, we currently have 4 school age, and the average per week has been anywhere from 4 to 6 school age that are reported to us from the public health nurses and case management. And right now we are managing about 38 positive COVID cases. So that's also staying pretty steady week to week and day to day. And we're continuing to have our COVID vaccination clinic, also flu vaccination clinic. So keep encouraging the students and staff and parents to get their updates on both of them, COVID vaccine and also the flu shots. And so and if they haven't received a COVID vaccine in the past 2 months, they're able to get the updated booster for 5 years old and older. So that one is the bivalent. So just to let you know that. Otherwise, our recommendations and protocols continue to remain the same and with advice on precautionary measures for COVID. And I don't see public health nurses on for their update, so we will move past that. And then I don't see Luana on as well for her update. So we'll move past that as well. Let's go ahead and see if anybody has any questions before we move on to new business. Is there any questions anyone has?
Sasha, this is Sally.
Hi.
Hi, good afternoon. Thank you for doing this for us again. You mentioned the 38 positivity rate. Is that the students or general?
Oh, just the general population total. Yeah,
okay.
not students.
Thank you.
Students, it's only 4 at this
Oh,
time.
okay. I didn't hear that.
And I know that we're continuing to do the notifications with the schools, and that's going fine. Process is fine. All right. Any other questions? Okay. And just continue to look at the Winslow Indian Healthcare Center website for updates on like flu vaccination clinics and events, and then also Facebook as well. We usually post updated stuff. Any other questions before we move on? Okay, great. Let's go ahead and move on. I'd like to introduce Mr. Chi, Mr. Ryan Chi. We have him a first item on our new business. Mr. Ryan Chi, hi, welcome to our meeting, and thank you for agreeing to provide us a presentation. And let me know if you need me to allow you to share your screen, and we can do that.
Please do so. Give me the privilege to share screens, please. Thank you for this opportunity to share with you a little bit about what's happening here at Loop Elementary School. Luana did inform me it's going to be about 10 to 15 minutes, so I will certainly do my best to keep it very short, concise, and most definitely at the conclusion of our presentation, feel free to reach out to me. Sasha does have our contact number, and if we want to elaborate on some of what you've heard today, please do so. And this, we're going to talk about trust-based relational intervention, which is TBRI. It is a model that we're using here at Loop. It's trauma-informed. It's coming out of the Early Childhood Institute, out of the Karen Purvis Center, out of Texas Christian University. So Loop has been selected as one of the sites worldwide this past couple of years to implement TBRI in an Indigenous Native American school setting. So we've had the privilege of working with renowned scientists and researchers, and began to look at the models and began to create tools that are replicated and culturally sensitive to our setting here on the Navajo Nation. So the three principles of TBRI is connecting, empowering, which is the physical needs of a student. Are they fed? Did they sleep well? Does their body need any, have they been meeting their physical needs as they're in our classrooms and come to our building? The second one has to do with connecting. And I think whether it be the school system, whether it be the healthcare system, relationship building, connecting to your students, to your patient, is the cornerstone of all movement that you will begin to work with families, patients, whatever it might be. But here in the school system, it's the individual student. How well do I connect with Gigi? How well do I know his upbringing, his family, his resources? So that allows me to begin to tap in to my interest into who he is. And lastly is the principle of empowerment, is how do I identify and replace behavior, whether it be modeled behavior. If a child acts out in a sense of he's screaming, you can't get a sense of control over him. How do I replace that behavior? And it is done systematically, it's done intentionally, and it's done with purpose. So when we talk about TBRI, we're really looking at the holistic outlook of a child. And I think from your perspective, from healthcare system, it's the same way. We're looking at the individual, we're looking at the mental, physical, emotional, and spiritual. So this takes the whole the whole deal, it takes the holistic approach of how do I work with children. And Sasha, I know I like to talk, so once I hit my 15-minute mark, give me, Mr. Chi, you have 3 minutes left or whatever it might be, just give me that information that I need. So that's what we're practicing here at Loop. We're in our 3rd year of full implementation. So we're finally stretching our arms and seeing how this is truly working with our students and our staff. I might note that all of our staff members, from the bus driver to the cooks in our kitchen, to our support staff, our teachers, everybody across the board has learned the TBRI approach here on our campus. And it's nothing new. When you really look at it, it's pretty much the concept of being Navajo, being Native American, that I'm beyond myself. Who I am as an individual connects to my family. It connects to my community. It connects to the wellness of all these other relationships that we have established. So part of that equation is self-regulation. The ability for a child to say, Mr. Chi, my body is in sync. All my systems are a go. Therefore, I'm maximizing my learning. The potential for me to truly learn is maximized at this point that I'm at. So in part of this equation is to teach children to learn to say, my body directly impacts my ability to learn, my ability for my judgment, and to make choices. So part of that is we've created this poster to the right that you see. There's different zones. So, and we gave Navajo names and Navajo animals to dictate so they could further connect with what they're experiencing. So throughout the day, if you're on my campus, you'll say, all right, 5th grade, College of Oklahoma, let's do an engine check. Mr. Chi, I'm green. I'm ready to go. Mr. Chi, my breathing is where it needs to be. My mind is sound and ready to go. I'm green, I'm ready to go. And through this process, they'll learn to recognize when they're in the yellow and when they're in the red. And granted, you've been trained, so now your mind as a practitioner is saying, I wonder if his physical needs were met. I wonder if the child's attachment needs were met. Those are now the prerequisites to reestablish that child in a self-regulation to be back into the green. And so could that apply to healthcare? Absolutely. What state of mind, what status are your patients in when they come onto your campus or into your service unit for care? And are your employees aware of what they're bringing here to your service unit or to our school? So it really is an elevated sense of, I know this person needs, therefore, how can I approach this individual? And you have all these tools and all these mindsets to say, here is this is the opportune time to give care and to give response. Likewise with our students. So you'll see here that we've created zones, green zones, the red zones, the blue zones, the yellow zones. Students are very aware of their self-regulation. Those strategies are embedded with our social emotional learning, which is carried out by our school counselor. So each child from preschool to kindergarten will know these zones of regulations. They'll know that self-engine check, and they are taught strategies to counter and to bring them back into the zone that's most beneficial for learning. That is also intertwined culturally with what in terms of clanship, in terms of the cultural teachings that we've been taught for generations, like the top one there, Nitzil Gonsin Kiss. Have mental stability, be tough mentally, look after one another, not only in that individualism, but corporately as a group, corporately as a learning body, we have some obligations to one another. And so part of that is knowing your clans. Yat ishi yaj, yat ishima, yat ishi shewe. You're establishing, again, going back to those principles of connection, of empowerment. And so when you think about your line of business in healthcare, how well are you establishing that connection when your patients come onto campus? Yat ishita, yat, and just that in term of endearment of yat goes so many lengths of the football field when you're establishing that relationship in that connection with whether it be students or patients. And so I shared with you all the coping skills that our kids are learning here at Loop Elementary. Some of them will say, oh, I'm going to take a breather. Some of them will begin to regulate their breathing. Some of them will say, oh, I need some water. I haven't drank water all morning. My brain needs to have water. So they're realizing that all of these wheels are turning within them. And again, to maximize that opportunity learning, they know these coping skills. An amazing feature that we've created also is our calming boxes. In each classroom, in each part of the building, we call them alcoves or calming centers. So they'll say, the other day I was walking down the hallway and Mr. Chi, I was observing this student in first grade, and they're like, I need to go to the calming center. I'm out, my color is yellow and might go to red. So therefore I want to get the calming box. And then we give them the nod. They know they take the calming box, they set the timer, and they'll get to the designated part of the room that calls for whatever technique or strategy they're going to utilize to get back into where they need to be. These are more the commercial end of the calming, the different tools that we have in our calming bins. So they can, they have a timed amount of time where they can utilize any of these tools. More so, we've made that connection culturally. So we have the string games that are there. They'll just sit there, they'll do their breathing and they'll do string games until they're reset to go back into the classroom. If not, they'll get on one of the looms. They'll do their looming, they'll do their weaving as they're there. And when time is right and they've been self-regulated and they're back to where they need to be, they go back into the classroom. Some additional support that we're adding is like this QR code has the corn grinding song. So they all have their own iPads and they'll have their own headphones here on campus. So they'll just simply put their, they'll get to the alcove, they'll put their headgear on, they'll scan these codes, they'll be humming or singing away with the songs that are provided, and they'll do the corn activity right here that you see in that Ziploc bag. Another component is that they can do leathering. So our students here have a leather crafting academy. So that stamping, and we see that sewing, all of those things we're beginning to realize are actually calming techniques from the culture perspective. So those are beginning to be implemented into the sensory bins as well. So it has been a fantastic journey. I know I probably cut it short. Sasha, how much time do I have?
It's such a great presentation. I want to give you a lot of time, but maybe, yeah, 2 more minutes.
Okay. So in that sense, why did we get here? How did we get here? There was pre-COVID, there was such an alarming amount of families within Loop that were experiencing trauma from suicide. We had a lot of suicide. So I began to search, what kind of tool can we bring aboard? What kind of tool can we provide for our students and families? So this has really grown with a partnership of Karen Purvis Early Childhood Institute. And I would ask that you even Google TBRI, and you'll see a lot of the YouTube videos that come up to give you a sense of the approach that we're taking here. Where do we go from here? We have a lot of students that are in the foster programs. We have a lot of student parents that are working with social services and the judicial system. We have a lot of families that are working with Winslow Indian Healthcare. So could we connect this dot with the other entities to be mindful in an approach that's in best practice for our families? That's where our question lies. And what steps are we going to take from here? And how are we going to utilize this tool? There's a lot of interest in Indian country of how Loop's implementation is going, where we're taking it culturally, all of that. So there's a lot of movement on our building. We're excited about it. We're now beginning to take data and measurements on metrics to see how we can, they'll soon do a research publishing on it as well. So it's kind of exciting, and I just wanted to share with it. I know Ms. Benslow was here a couple of weeks ago for our campfire session with our parents, and it was really a good turnout. So Sasha, I think that's up. My time is up, and I certainly want to thank you for this opportunity to share some great things that are happening here at Loop Elementary.
Thank you, Mr. Chi. Awesome. I want to give a couple of minutes if anyone has any questions for Mr. Chi. Any questions?
Sasha?
Yes, go ahead.
Yeah,
Hi.
yeah, yes, Ryan.
Hashinayat Ishma, how are
Oh,
you
yeah,
doing? It's good to hear your voice.
That's very interesting what you're doing, the model that you're using. I think that's needed, especially, the people we went through COVID pandemic, and there are a lot of issues mentally and physically.
Oh,
And so this type of, with the integrated approach in addressing some of these issues, this is fantastic. And I was just wondering, thinking about all kinds of things here while you were doing the presentation, with our health, you kind of alluded to that. It's been along as far as way back when I was in nursing school. We integrated the holistic healing, and that goes into like physical, mental, and emotional, social, intellectual, even spiritual, all that in helping a patient. It was really drilled into us, and I even had to take theology in one of these areas in order to understand. You have that respect for patients when you care for the patients. So and how you help them. So it's really interesting what you're doing. And I'm wondering if the Navajo Nation, they have that school board. I'm not very familiar with how they're set up. If something like this could be implemented across the board, that will be wonderful. And I don't know if you ever have that kind of meetings with them, with the Navajo Nation. And of course, there's BIE and contract schools and all different schools, parochial schools. So it's really interesting about what you're doing. Yours is a public school, right?
Oh.
Yeah. So, what you're doing, for sharing the information with us.
And we're always open to presentations or sharing with others, because this is certainly a tool that's going to be essential post-pandemic. And one that we found was that even my colleagues, among our colleagues, we did engine checks every morning And that was a great practice. And when we had Miss Begay, who was in yellow, we knew, let's check on her periodically. Let's get her her favorite drink. Let's make sure she has lunch. Let's make sure that we offer a break when she feels like she's beginning to climb higher into that red zone. So just among colleagues, and it's great practice. I think that's what got us through the COVID, the pandemic. And so we continue some of those tools and skills that we've learned. So thank you, Shema. It's always good to hear your voice. Yeah.
Thank you.
Okay, great. Thank you so much again. That was very, very good. I really appreciate this, you sharing the information, you know, to even inspire all of us in other schools and, like you said, workplaces and organizations. So that was really good. I like that. So, okay, we'll move on to the next item. Next item on the agenda is a presentation by Ashley Carlock with Cycle Kids. Welcome, Ashley.
Thank you.
Uh-huh.
First off, Mr. Chi, I used to be a teacher of kids who were in and out of juvie, a self-contained high school class. That program would have been, it just would have been so awesome for my students.
Mhm.
I think that you're doing good work. So thank you. But a little bit of, I'll keep this pretty quick. I don't have a PowerPoint or anything. But I did in my message, you'll see that I linked to the Cycle Kids website. So you guys are definitely welcome to go check that out. A little bit about myself. I am a professional cyclist currently living outside of Cortez. And cycling has changed my life in a positive way. And when Cycle Kids offered me a position to help get more programs out in the Four Corners region after looking at their program and their model, I just couldn't say no. So here I am. And I've only been with them for a few months. And I'm working under a foundation called the Katina Foundation. And they've given us enough money to start 8 programs. And I have 2 already, possibly 3 now today, hopefully 4. So I would like to get all of these programs started by the end of this year. What Cycle Kids is basically just getting kids on bikes through the school, but it's not only about cycling safety and getting the kids moving. It's also about nutrition and their self-confidence, which I think is something for 4th and 5th graders, which is what the program is detailed for, is very, very needed. What I'm looking for right now are schools to partner with. So they are all intended to be taught within the schools. It's an 8 session within 1 year. A lot of the PE teachers will reteach these sessions. It can be, it's a pretty structured curriculum, but a lot of times, sometimes they're going to reteach these sessions because the kids are going to want to be on the bikes. They're going to want to go over the flat tire fixing again. The other thing about the grant is that a lot of what I'm kind of coming against is a lot of grant fatigue. So when I tell people, oh, this is a free program, they're expecting that they're going to have to do a whole lot of things to keep the grant. And that's with Cycle Kids, that's not true. The only thing we would require would be a 2-year commitment to teach, a pre-assessment for the students and a post-assessment for the students. And then time with me to kind of go over the curriculum, which really doesn't take that long. The curriculum's pretty self-explanatory. Within the grant, the school receives 10 bikes, helmets, 50 student textbooks, and a teacher teaching guide. everything else, but the bikes will belong to the school. They're welcome to keep those bikes and those helmets. It's a pretty simple thing. And what I really need are advocates within the Native community so that people can understand that this is legit. And it is something that I think is beneficial to all. So Cycle Kids has been operating since 2004, and in 2008 they partnered with Boston University to make the curriculum, and then after that we are now in 13 states. So, and we have been on the Navajo Nation for a little while. That's really it. And if you have any questions you want to ask now, that would be great. If not, you can always email me. I think my email is on this. If not, I can send it. I'm meeting with the Katina Foundation tomorrow. And the only thing I would need from schools to get them to approve would be their school demographics. Just a little bit of information about the school, PE teacher, number of kids, reduced free lunch, and that kind of information. But yeah, it's just about getting kids on bikes, getting them moving, healthy, happy, and giving them that self-confidence, which I personally gained when I started riding and racing. So that's it.
Thank you, Ashley. Thank you for sharing. And we're thankful that and excited that we were able to meet you and connect with you and bring this program to our area. So does anyone have any questions? Ashley, can you go ahead and put your email address in the chat? That would be great.
Yes.
Any questions? Okay. All right, we'll go ahead and move on to the next presentation. That's going to be by Elvira Aguilera. She is from Navajo County. She's from Navajo County. So go ahead, Elvira, you're on. And if you need to share your screen, you can go ahead and do that.
All right. Well, good afternoon, Sasha and everyone else. I myself don't have a PowerPoint presentation. This will be all ears, so make sure they're open. So yes, I work for Navajo County Public Health Department. I solely work with tobacco education and prevention. So most of my scope of work is I coordinate with a lot of the schools here and here in Winslow, but I try to stretch it out throughout the county. But because I'm home based in Winslow, I coordinate with the schools here. So I would figure this is a good opportunity to present the struggles that the schools are going through right now with the vaping. So a lot of these adolescents are getting caught with the vaping devices. Majority of them are tobacco. Some of them have a little bit of marijuana in them, but we have never came across one that was laced, so thankfully. But my awareness is to spread out to that. I wanted to bring you guys to get involved. I want to coordinate along with you guys with your school assessment with like the school task force, because I'm going to work alongside with the schools, kind of give you guys an image of how many students are getting caught vaping. Is the number going to lower? Is the number going to rise? I do go into schools and I do teach them a curriculum. It's an alternative to detention or suspension. So they have to, the schools have to come with me. We'll get together and they have to do this program with me in order to resume back to their classes. Only because most of these students aren't aware what's actually in these devices. So just to kind of go over background, e-cigarettes, they are battery powered tobacco and nicotine device. So it contains a lot of nicotine. just so whoever doesn't know what vaping is or e-cigarettes, it is a tobacco product. And when students get caught vaping, they aren't aware what's in these devices, and that's where I swoop in. I kind of give them, educate them the background of it. And I would say 90% of the times these students don't actually know what they got their hands on. And so this will be an eye opener. So as little as third graders are getting caught vaping. And then from there on, it's third to 12th grade. So right now we're just trying to see how we can eliminate that. I am the only one with the Navajo County that works with tobacco prevention and education. So I am everywhere, but that's why I thought would be a good opportunity to, join Sasha and the WANA to see if we can add the vaping, the rise, or see if it's just the numbers, just to get out there. That way we can protect our youth. So protect them from nicotine addiction. And that's what a lot of these tobacco companies do, is they target and they aim heavily towards adolescents when it comes to advertisement. And most tobacco companies are limited where they can advertise, but again, they lure more towards the adolescents, because they think it's just all flavoring. It's, makes them look cooler and so much further on. But I just figured, we can try to coordinate something together.
Great, thank you.
Mhm.
Thank you, Elvira, for your presentation and information. And it's just a whole new, day, in the age now. And I would have never thought we'd have such a thing. And just the accessibility to our kids, what would you say is the youngest child that you guys became aware of getting a hold of these?
I'm not sure by age, but I just know in third grade. It was a third grade student that got caught vaping. And just to give you guys paint you an image. So vaping devices are more disguisable, only because they don't want parents to know. They don't want staffing from education know. So I'll just kind of give you guys, I have two examples. I have a look-alike and I have the real one. So this is, what does this look like? Whoop, my blur. So this,
the flash drive.
yes, this is a flash drive, an actual USB flash drive. And this is a vaping device. So they look very similar. And here's another one. This is an actual vape device. Looks like a highlighter to some of us, looks like the whiteout. So the one that I'm holding right now, and just to kind of give you guys an education, the vaping devices usually average around 31 milligrams of nicotine, and that it's a pack and a half of cigarettes. And some of those kids have attested to me that they go through that once or twice a week. So that's either 2.5 packs of cigarettes or a pack and a half. And most of them, they're like, it's just flavor, it's all flavor. I'm like, no. So once they find out what's really in them, it's eye-opening for them too, and it scares them. So and then there's like ones like these are disposable, one-time use. So yeah, and then like the average Soren, the one I just showed you, this one has 121 milligrams of nicotine. So if you do the math, that's half a dozen of pack of cigarettes. So, and these kids that are getting caught vaping, they share a little bit more information where they got it from. Most of them are getting them from their family members, unfortunately. Some of them, they find them on the street and then they still work. And some of them are, unlike the disposable, some of them are rechargeable. And it just takes a USB-C that's all they need to do is find that to recharge it. So.
Wow. Okay, and are there any health effects you see as far as like, increased heart rates, increased blood pressures, or
As
because
for adult,
you can't really like detect it kind of,
Mhm.
like in a drug screen,
Mhm.
right?
If you do, they have actually nicotine strips. And then most of these devices that get confiscated from the schools, I got at least about 15 confiscated devices from 3rd to 6th graders in the last year. Most of these, I send them back to the state, and the state, says this is how much nicotine was in these devices. But for adolescents, it definitely affects the development of the brain. So, slowers their cognitive, their motor skills. Adolescents, it'll decrease, their learning capabilities. And obviously it definitely targets the lungs. And, because of the COVID-19 around, most of that just sped up their symptoms. And unfortunately, some of them have passed away because their lungs were already weakened from smoking these e-cigarettes.
Wow, great information. Thank you so much,
You're
Elvira, for your
welcome.
presentation, and
You're welcome.
all of those who are on our meeting today. If you want to reach out, go ahead, Sally.
I was wondering, how do they refill that? Do they have suppliers? I mean, I'm sure they're out there, but just wondering, what is it? Is it in powder or powder?
So some of them are refillable with the e-liquid. I have another device. You just pop open the top and you pour in the liquids. But the ones that are disposable, they're already they don't need added liquid to it. And each device usually carries around 2,500 to 3,000 puffs. That's a lot. So most of them are pre-equipped already.
Wow. So what about the price?
The average one cost is around, I would say, $35, and that's with the liquid inside as well, because the liquid can be sold individually from $8 to $15.
Wow.
Yeah, and like I said, these kids do pay other people to go buy them these devices or products.
Oh my goodness. We're really in trouble.
Yes. Yes, like I said, we're trying to protect the youth as possible as we can.
Thank you so much for the information.
You're welcome.
All right, any other questions for Elvira? Okay, I'd like to go ahead and thank you, Elvira. Thank you so much again.
Thank you for having me.
We'll reach out to you. You're welcome. And I'm gonna give this time over to Luana to share some updates and also information on events.
Hi, everybody. Sorry I was late to the meeting. Thank you, Sasha, for connecting me. So for the school health updates, I just wanted to share with you just a few things. One of the things that I wanted to share was we had sent out 24 MOAs, and for a while, we were waiting on a few of them, and we finally, as of Monday, we have all 24 schools have executed MOAs. So yay, I'm so happy. So which means that we're able to work with all of our schools that are in our service area, and that's great news. And
Terry ended up being there almost all day.
so the next thing that we're just waiting on are the consent forms that the schools need to fill out and get signed by parents. for permission that we can work with their kids. And then the school assessments, we're still at 20 out of 24 schools that have filled out the assessment, which is really helpful during our family health nights. This really gives us a lot of information from the schools to share where their needs are. Let's see. Events that are coming up. We did have our first family health night at Jedito, and we had 40 participants there, both children and adults. And we had 6 presenters. And we had I believe 9 booths set up. So our next family health night is going to be at Delcon School on November 15th. I just did a site visit there, trying to figure out the logistics as far as the layout, how that's going to look. So that I went there yesterday, looking good. And, you know, at every event, you know, we look at things that, what were some challenges. So some of the challenges at Jedito was, I didn't provide an agenda of the presenters. So I'm going to make sure that at each of our, all of the rest of our family health nights that we're going to have a printout of all the presenters, and an agenda for that. So yeah, that was something that was, I forgot to do. And it was very important to provide the information for the parents when they first come in. That was one of them. And then we do have 2 others confirmed right now. So the one in December, which is December 8th, that's going to be at LSI, Loop Schools Incorporated. And then for January 12th, 2023, that one is going to be at Saba, and I confirmed with them yesterday. So we are slowly planning, and I don't want to call the rest of the schools too far ahead, because it may be forgotten, you know, but about 2 months prior, that's when I would like to slowly start trying to fill up those other additional dates that we have for our family health nights. But for sure, the last one, which was requested by Star School, was to have on April 27th, 2023. So that one is confirmed as well. And these family health nights are 2 hours from 5 to 7 p.m. We do want to work with the schools because they're sharing information with us that we're going to be able to provide education, not only for the students, but for the parents as well. So that collaboration is very important, working together to make sure that it's a fun, exciting, educational night for their parents, their students and their parents. So that's very important, working together to make this happen. Like I said earlier, we're using the school assessments to guide us through to what type of education we're going to provide during these evenings. And the other project we got started in communication with is to start our health education videos, which these videos, we are going to hire a videographer to help us with these short, simple educational videos of some of our popular, most asked for presentations. And we want to show these presentations and upload it onto our website. That way, all the schools that you guys as schools are able to go to our website and say, oh, do you know what? We want to show a video on bullying. And bullying is one of our popular most asked for presentations. So for example, like bullying, oh, let's go to the website, see if they have bullying on there. And then, say, oh, they do have a video on bullying, and to be able to show that to their class. Because it is tough to, as a presenter, to be able to go and hit all the schools in a most popular asked for presentation. So this would be very accessible for you as a school. and also parents to view, sharing this information with the parents. That way they can view the presentations, show it to their kids. And that's what we want to be able to build on, starting with 10 videos. So we're in that process. I'm so excited about that too. So we're going to have these videos and everything. It takes a little bit to work on. And then with the editing process and everything. So, but I'm excited. We're moving forward. So you're going to see these videos in January. I'm like so thrilled about that. Let's see. And of course, the community activities and working with our other community programs that are out there, being able to show support, like Ashley was talking about earlier about her Cycle Kids. That's, that's a program, what she's doing. We want to partner with programs that are reaching out to our youth, to our kids, to our students, and then, make it happen in our area. Ashley comes from Cortez, Colorado. So having her come out and provide this program to some of our schools is like awesome. This gives us an opportunity to have more activities and more opportunities for our kids. And that's what we want. And then if there's any other outreach opportunities at your school, say parent-teacher conferences, I know those have already passed, but any other activities that are coming up that we'd be able to, not only our organization, but other programs that we've invited to the meetings, and then for us to be able to share with other programs, that those opportunities to set up an outreach booth at their schools. Let's see. With the Cycle Kids program, we also want to partner with the CHSN bike program, and that's with Claudia Jackson, who's out of Indian Wells community. She's a great local program that we really want to utilize, she's doing great things out there, and we want her to be a part of that, and we want to partner with her as well. And just utilizing all the resources that we have that are, within our reach, but also, beyond that too, and even their connections. So thank you for this time. And does anybody have any questions for me? All right, I guess no questions. Thank you, Sasha, for filling in.
No problem. So
Hey, Sasha, this is Janelle. I believe you're on mute if you are talking.
oh, sorry. I have the situation report available, and if you have a few moments before we end the meeting, it shouldn't take long, but I got it here. So we have a 14-day positivity rate of 13.3%, and you can see the little curve on the right. It's at a pretty steady rate. And then the hours of vaccine and drive-through continue to be 8:30 to 4 o'clock. And keep in mind, if you're planning to come this way, or you send staff or families this way, they are closed from 12 to 12:45. And then the next one, oops, sorry. So just a picture of our COVID drive-through testing and vaccine clinic for COVID is on the right side of the main entrance of the medical office building. It's for COVID vaccines, 8:30 to 4, closed
And-
at lunch.
And flu vaccine.
Oh,
Flu
wow.
vaccine, adults 19 and older can receive a flu vaccine in the vaccine clinic. However, 18 and younger will have to check into walk-in clinic to receive that in the main clinic.
Okay, so flu shots for adults and COVID vaccines for all ages there. And then we have some events to announce, flu shots, 8:30 to 4, and mobile unit will be out in the community. And we have these, we're calling it COMI instead of JMI. This is for our fall event, Keep on Moving It, which is a walk run series. And they are doing A1C screenings at these events. Today they were out at Loop Schools Incorporated. And next one tomorrow, White Cone Senior Center. On Friday, Delcon Bashes. And December 1st, Twin Arrows. So there's some nice incentives there. And people can get their A1Cs checked at the same time. So great events. We invite you to come out. We have our wellness center open to our beneficiaries. So we have calendars like this posted on the websites and also on Facebook. But there's some instructions here. The hours are 6 to 3. Updated waivers are required, and required also to book your exercise time on MindBody. It's an app, so if you want to come in and exercise, it has to be a time slot reserved, and it's a reserve for 45 minutes, and they are limited for 18 years old and older, must wear a mask, and so there's details there on the timeframes of like just the classes. So like yesterday there was Zumba with Terry and also step class with Terry. National Native American Heritage Month, and we celebrate that with you. Just some events going on with the Navajo Traditional Medicine Program. There's Navajo Bingo that takes place on different days, on Thursdays from 11 to noon. And it's outdoors. It's on the south patio of the main office building entrance. And then Lunch and Learns as well. Zoom webinar taking place every Monday, 11 to noon as well. There's Zoom information there. And this month for November, it being Diabetes Awareness Month and Diabetes Prevention Month, there's a punch card opportunity to get some incentives and try to motivate us to get back in a routine of exercise. So the details are here. That's also been posted on Facebook, and we encourage you to get involved and also to know your numbers as well. So there's just different opportunities to earn a punch in your card. And then updated COVID boosters, the updated Omicron specific COVID boosters available for 5 years old and older. So next is alert on fentanyl. I hope that you're able to share this information with your parents just to keep them aware of this popularity of fentanyl, which looks like candy a lot of times, but it's very dangerous, and it doesn't take very much for it to really hurt someone, even to the point of killing a person. So we need to be very careful and educate our kids and families about it. So there is a Substance Abuse Prevention Center in Hopi that are providing a class beginning October 18th to December 15th. Information is there. And here is a suicide and crisis lifeline. Call or text 988. Patient-centered medical home. Just hopefully you all have a primary care provider, and our kids need one as well. So it's very important to help with coordinating their care, whatever their needs may be. Information is there. And COVID mitigation practices remain with vaccinations encouraged, good hand hygiene, be mindful of social gatherings, wearing a mask in public indoor spaces, stay home if symptomatic, and get tested. Monkeypox info is here as well. the different symptoms. We haven't heard more cases arise or anything like that, but we still want to just be aware of it and have the information in the back of our minds so that we know. So that's the situation report that I wanted to share with you. And we are recording the meeting, so if you need to refer back to the recording, you're able to do that as well. And so the next meeting is going to be on December 7th. So there'll be a meeting until December 7th, and Luana will send out the invitations, updates. But as always, if you have questions, let us know. Contact Luana by email or phone. So any questions or comments?
Hi, hello.
Hi, Alberto.
Hi, Sasha. Thank you, Sasha, and all that have presented and commented. You shared a slide, or not a slide, but a flyer. I believe it's in regards to 988. That's the crisis hotline. For Arizona, we're wanting to promote the established crisis hotline for those residents that live in Arizona to, when they do call the 988, and usually when it's pinged off a mobile tower, it's usually sent to a different location. And sometimes individuals that move into Arizona, and if they were to go through that hotline, you would usually go by the prefix that is on their mobile number. So what we have started to do is begin to promote the crisis hotline of 1-844-534-4673. And that's just an addition. And I believe Navajo Nation will be making that number also. We'll probably begin to be promoting that number once President signs a memorandum of understanding with an organization in regards to that. But I'll email you directly additional information in regards to that hotline that was just recently established, and that took effect on October 1st of this year for our state. So, but 988, it's still good, but I guess we're really wanting to begin to promote the 844-534-4673. But we do know that 988 is pretty simple and
Yeah.
people can understand it. So I just wanted to bring that to your attention. But overall, thank you.
Okay, great. Thank you for that. And please email that update to Luana. Thank you.
Will do.
Okay. All right. Thank you all. Thank you for your time. Everybody have a good rest of your day.
Thank you, Sasha and team.
You're welcome.
Thanks, everybody.
Thank you.